I figured it was probably a tornado, and just figured the best thing to do was to get somewhere safe. The only thing I could think was to go to the bathtub with the kids, and I just made them all huddle down in the tub and hold on.
In October of 2016, Hurricane Matthew left a path of destruction from the Caribbean to the southeast U.S. with widespread flooding, storm damage, and power outages affecting over 1 million people. Meanwhile, the Department of Veterans Affairs, staff, and resources from around the nation were sent to VA facilities in flooded areas of North Carolina to help meet the medical and social service needs of veterans there. Fortunately, the southeast coast was spared a direct hit by Hurricane Matthew. But what would happen if it wasn't? How would a community respond to a hurricane that could devastate its city and demolish everything in its path?
Essentially, the scenario for this exercise, which is called Sunshine Endeavor 2017, is a Category 5 hurricane that hits or makes landfall in the state of Florida, west of Palm Beach County, and it goes across the state.
Exercise Sunshine Endeavor was held in early June of 2017 in West Palm Beach, Florida. Triggered by what could have happened with Hurricane Matthew, it tested the capabilities of the VA and the local community to collectively respond to a catastrophic Category 5 storm dubbed Hurricane Thomas.
The fourth mission of the VA is to provide medical care to civilians and responders in a time of disaster. This is in addition to our daily business of providing care to veterans. During a disaster, we are required to be able to provide to both of those.
For the VA, it also tested its important fourth mission, being prepared to answer the public's call for help.
Building coalitions, building partnerships to develop more resilient communities is what Sunshine Endeavor is all about.
What originally started as a strictly VA exercise quickly grew in scope as more and more community partners joined in to reap the benefits of practice for what could indeed become their worst reality. The extraordinary support and collaboration of Palm Beach County Fire Rescue made a huge difference in the success of the exercise. When it all came together, Sunshine Endeavor was the first of its kind full-scale exercise with over 20 local, state, and federal partners and more than 400 people participating in some form or fashion.
We have numerous pieces of equipment from mobile pharmacies, mobile vet centers, mobile hospital units that we're setting up for clinical operations. So it's the first time that all these resources have come together at one time to actually work in a cohesive manner.
This site is a great location for this type of exercise because of the footprint that's available to us. In speaking with the exercise designers, they wanted to really test out the logistics of moving equipment, setting up this alternate care facility, this alternate care site, making sure that we had enough available space so that partners from around the county, around the state, and around the country could come in and really set this up as if it was real life.
Operations for the multi-organizational exercise were staged at the expansive Palm Beach County Fire Rescue Training Complex. Exercise planners, evaluators, and others worked out of a mobile command center and joint information center to direct and support the large assembly of emergency response forces. And bad weather only added to the realism. One major test for the VA was setting up and operating a field hospital, otherwise known as an alternate care facility. In a catastrophic hurricane, hospitals would be damaged or evacuated, homes destroyed, and people injured. Veterans and private citizens would arrive or be dropped off seeking medical care and help with their medication, housing, and social services. Some who had injuries beyond the scope of the urgent care available would need to be transported to other locations either by ambulance or by air. The VA and its partners, including the U.S. Coast Guard, provided that realism and more during the exercise. Hundreds of volunteers, staff, and observers were a hub of activity during the exercise.
At the West Palm Beach VA, we have volunteers here all the way from our service chiefs to supervisors to frontline staff to some of our volunteers who are out here working on this.
Many of the exercise players were VA medical professionals from the local VA hospital and elsewhere.
All right, excellent. We have Jennifer over here. Do you mind having a seat, Jennifer?
Their job was to assess and treat those affected by Hurricane Thomas or to arrange to transport them to where they could get the help they needed.
This exercise is important because we need to be prepared, totally prepared for whatever might happen with the weather in the whole state of Florida and southern Georgia, which we represent. So we want to be out there prepared, ready to help.
Sunshine Endeavor 2017 was definitively a total success. We were able to bring partners from all across the region to play together in the same sandbox. We were able to identify lessons learned that we definitely want. Once we address those, will enhance our resiliency and our capabilities to really respond to hurricane events and to really work with communities in providing continuity of patient care.
Officials agreed a lot of important lessons were learned that will help the VA and its surrounding communities to be better prepared for the real thing. Sunshine Endeavor, partnering with the community prepared to respond, providing a roadmap for the future.